There are a lot of myths about scleroderma and skincare and a lot of autoimmune diseases in general. Once you're diagnosed with scleroderma, people hit the internet and they read things and they see incurable. But it's important not to panic because there's so much that you can do ahead of time so that you're in control of the disease and the disease is not in control of you. When nurses are looking for products to manage fragile skin, there's some key things that we look at. The first is it going to do what we want it to do? So is it going to gently cleanse? Is it going to protect? And we want to be sure that the ingredients are very natural and aren't going to cause problems with allergies or sensitivities. If you're in the hospital and you have scleroderma, most of the time you're going to use the regular hospital regimen that they have for all patients. And they really are designed for fragile skin. They're kind of assuming if somebody is in the hospital, they probably have more fragile skin, and so they want to use products that are going to not strip the skin. So avoiding good old-fashioned soap and a washcloth, which can cause too much friction as well as damage the top layer of the skin, you're going to use usually a pH balanced cleanser. Some of these are no rinse, others require a rinse depending on the hospital and the products they choose. And then a standard moisturizer that's designed to help retain moisture. Now it varies depending on the hospital of how protective that moisturizer is going to be. They may have just a general moisturizer for the basic patient population and may have a higher content of protection for those with more fragile skin. So that usually if they know that you have scleroderma, they're going to bring out something that's going to offer you more protection. Those products that are used in the hospital can be very useful while you're there, but they can be really hard to find or purchase when you get out. And this is where HomeCare Pro can help you because it's readily available to consumers. It's not as expensive as what you might have to pay for if you purchased from a durable medical equipment company. If you try to get what the hospital uses, it's cost-effective, it's readily available, and it is the same or even in many cases superior quality of what you were using in the hospital.